My surgeon told me I was imagining my symptoms for attention. 6 months later, he needed the emergency procedure he refused to give me. I'd been in excruciating pain for over a year. It started as an occasional sharp pang in my abdomen, but gradually intensified until I couldn't stand straight most days. After 3 IR visits, countless tests, and appointments with 5 different specialists, I was finally referred to Dr. Maxwell, supposedly the best gastrointestinal surgeon in the state. I arrived at his office clutching a folder of my medical records, test results, and a daily pain journal I'd kept for months. I was 28, single, working remotely as a software developer, and desperate for someone to take my pain seriously. Dr. Maxwell barely glanced at my materials. Within 10 minutes, he leaned back in his chair and delivered his assessment. "Ms. Parker, your tests don't show anything conclusive. A rate on your age and profile. This is likely stress-induced irritable bowel syndrome, possibly exacerbated by anxiety." I tried explaining that the pain was so severe I'd lost 20 pounds because eating had become torture. I'd been forced to move back in with my parents because I couldn't take care of myself some days. He smiled condescendingly. Young professional women often internalize stress in their digestive systems, and sometimes attention-seeking behavior can manifest as physical symptoms. Attention-seeking, I'd been hiding my condition from everyone except my closest family, embarrassed by my constant bathroom needs and inability to live normally. "I really think here is something physically wrong," I insisted. "Could we at least consider exploratory surgery? My previous doctor mentioned possible endometriosis on my bowel, where I don't perform unnecessary surgeries," he interrupted. "Take these antispasmodics, follow up with a therapist, and practice stress management. You'll feel better in no time." I left his office in tears. 2 weeks later, when the pain became unbearable, my parents drove me to a hospital in the next state. Their female surgeon immediately scheduled me for emergency surgery. They found extensive endometriosis that had wrapped around sections of my bowel, causing partial obstruction. If left untreated much longer, it could have become life-threatening. My recovery was slow but miraculous. As the inflammation decreased, I could eat again, sleep again, live again. 6 months later, I was back at work, thriving in my new role at a major tech company. During a virtual meeting, my team was introducing our new medical consultant. A familiar face appeared on screen. Dr. Maxwell looked much different than I remembered. Gaunt, tired, and obvious discomfort, he explained. He'd be working part-time during his recovery from recent surgery. Later, our project manager filled me in. Dr. Maxwell had experienced severe abdominal pain for months but had dismissed it as stress from his divorce. By the time he sought treatment, his appendix had ruptured and caused peritonitis. Hound surgeons had declined to operate, considering it too risky, until one finally took the chance. During our next meeting, Dr. Maxwell didn't recognize me with my new last name from my recent marriage. As he complained about doctors not listening to his symptoms, I finally unmuted. "It's terrible when medical professionals dismiss your pain, isn't it, Dr. Maxwell? When they suggest it's all in your head or that you are seeking attention." The silence stretched uncomfortably. "Life has a way of teaching empathy to those who lack it," I said softly. "I hope your recovery continues successfully. I know firsthand how validation and proper treatment feel after being dismissed." He didn't attend our next meeting. The company found a different medical consultant. I sent him one email after that. Just my operative report and a gift certificate for a medical journal subscription focused on women's health diagnostics. No message needed. We both understood the lesson.